Hi, good morning. I must relate to you that last night I was interviewed with my daughter. I talked about my book, Nurse, the Guide to Empower New Nurses in the Delivery of High Quality Care to All Patients. This is important to me. Do you know what happened? I actually talked about content of my book, and it was really, really interesting because there are many nurses out there who might be timid. And I did talk that there are things in this book, tidbits, there are nuggets that you as a new nurse can embrace. And refresher, of course, for the older nurses, the seasoned nurses. And I did mention on communication, in particular, therapeutic communication. And I will read something from my book this morning on page 20, therapeutic communication. It depends on verbal and nonverbal communication. And when you use it effectively, it's far reaching. It helps to improve the physical and the psychological health of your patient, of our patients. Now, therapeutic communication includes such things as active listening, silence, touching, talking. Active listening can be interactive and will demand your undivided attention. Listen, paying close attention to a patient's word and body language will help, yes, will help you hear the messages that are unspoken. Interpreting them carefully will make you a vital part, will make you a vital part of generating an appropriate plan of care for your patient. As you work along with the rest of your team, be equally aware of communication between you and your nurse colleagues and between you and the attending physicians, because you will most likely spend more time with individual patients than their doctors. The doctors will, like physician assistant, you may notice things that the patient's physicians might miss. If you're a prudent nurse, you will inevitably notice specific information that the doctor was not aware of. You shouldn't hesitate to communicate that to the doctor. That will enhance your patient's plan of care. That might seem stressed and overstressed, but it's so, so important that you communicate effectively with your patients, verbal, nonverbal. Encourage your patient as you have the right attitude towards your patient, as you give that listening ear, as you sit for a minute or two with your patients, although you might be busy, just to listen to them. And when the patient sees that you have that interest in them, they will relate things to you that you would not have received otherwise. So my encouragement today to my new nurses is take a little time out to listen to your patient. Take a little time to build that trust. Take a little time to interact. It might not be long because we know that with the shortages and everything like that, you don't have a lot of time to be with one patient. And especially because we have to document. But although we have to document, that patient-nurse relationship is critical. Continue doing your best. Ask for help when needed. And guess what? Job satisfaction, nurse satisfaction, patient satisfaction, all of those will enhance the patient's recovery as close to optimal, if not optimal health. Be blessed today. Share. Pay it forward. Share with someone who is after you, who don't yet have your experience. And this noble profession, you will always hear me say that, this noble profession continue to be noble. How can you connect with me? That's a great question. I'm on different platforms, including YouTube. YouTube, Miriam Amanda Smith. On Spotify, Apple. Yes, I'm a podcaster. So you just have to insert Empowering New Nurses. That's on my website also. Remember, if you have a topic that you would like us to discuss, do so. Share it in the chat. Yes, in the commentary. I look forward to hearing from you. Make a comment, a helpful comment, so that others can be benefited from this session. Thanks again. Look forward to seeing you.